In this video today, we're going to talk about, can TMS or transcranial magnetic stim help stop patients from needing to use psych meds permanently? If we haven't met, I'm Dr. Orlando Landrum, and I am a physician that helps patients understand their options, how to be able to evaluate those options, and figure out how they can be able to punch either mental or physical pain in the face and get back to leading the life they deserve. So in this video, when we're talking about, can TMS or transcranial magnetic stim be able to help stop psych meds from needing to be able to be utilized and stop them permanently? If you hadn't guessed, it's yes. Now, is that the case all the time? No. Is it the case for every person? No. But can that be the case? It could. Now, the fact of the matter is, I have to put kind of a label onto this and say, before we talk about stopping medications, that should be done with a provider who placed you on the medications, made sure that you have a degree of stability that's in place, and that things are going consistently well. And more than likely, that medication needs to be titrated, meaning tapered or decreased slowly, as opposed to stopped abruptly with a potential issue that occurs. So with that caveat, let's take a look at some literature, some research papers that actually have evaluated this and what was the context in which this existed. For those of you who haven't seen a TMS chair before, this is an example of one where you can see the chair that's in place. The patient sits in the chair. You have an application of a magnet that's close to the area of the head, and that magnet then actually causes different changes that are present within the areas of the brain by providing various different electrical current that is not actually perceived, and that can change neurotransmitter levels. It can actually improve how the brain talks to itself and improve overall mood and stability. A paper that looks at this specific question is the following: can medication-free, treatment-resistant depressed patients who initially respond to TMS be maintained off medications? And they looked at a 12-month evaluation over multiple different sites. So let me be clear. First and foremost, this may not be an indication for you the same way as this paper represents, but it's a possibility. And sometimes being able to identify the areas of hope is very useful to saying, this is something that allows for me to be able to go on. And that's what we want to provide you. Not false hope, but hope that has a scientific basis that shows that you may be a candidate for something such as this. So this looked at a number of previous studies, and they looked at a small number of patients for the most part. And what they found is that some patients had a relapse, but a good number of them did not necessarily have a problem long term. What this paper showed is the following, is that over 6 months, 62% of patients were able to maintain their level of symptom relief, so meaning not having depression. But the way that they did this is with TMS maintenance sessions. So traditionally, they would have a 5 treatment delivered over 2 days. And these are patients who had previously responded. And that was done with the context of being able to make sure that they didn't need to change, increase, or add medications in order to be able to maintain that. And what they were able to see is that patients who had responded were able to be able to do this safely with not an increase in depression or suicidal ideation. There was one patient that had a short increase, but that was it. And it helped be able to provide a maintenance type therapy that allowed patients to be able to figure out how to continue to be able to get suitable, long-term, sustainable treatment for depression without having to rely upon other therapies. If you found this video useful, please hit the like and subscribe button so you can get access to other videos of a similar nature that can help you understand how to be able to deal with pain that's bothering you from a mental health standpoint and get back to leading the life that you deserve. Thank you.